Low back pain is the 5th most common issue that drives people to the doctor's office. And it's honestly that common. But the initial treatment for the first month often includes easy home strategies that don't really require a doctor's prescription. I'll review 3 important tips on what doctors want their patients to know about low back pain, and then 6 tips to help treat it on your own. Well, what's up, healthy people? I'm Dr. Majd, host of the Majd MD channel, here to help save the busy person an unnecessary visit to the doctor. Here's what most doctors will want you to know before you schedule that visit for low back pain. Did you know that 90% of low back pain resolves or significantly improves within a month? Yep, with the first week often being the worst, and then it gradually improves thereafter. If it hasn't resolved within a few days, please don't panic. Tip number 2, I'll tell you, most people cannot recall an event that triggered the pain. That's because after an injury to the area, the immune system often takes 24 to 48 hours to mount an attack and create the inflammatory response to help repair the damage. And partly because it's not often an acute event, but something more subtle, like let's say repetitive motion, like repeatedly bending over or twisting, heavy lifting, think your 3 or 4-year-old, prolonged sitting like a car ride, or improper posture. Most people have not experienced a trauma that triggered the event. Now, most back pain is benign and self-limiting, whether it's due to a muscle strain, a disc bulge, or even arthritis. However, there are a few more concerning signs and symptoms that you should not ignore. So if you're experiencing any of these, please see your doctor right away. Number 1, if your back pain began after trauma, like you had a fall or an accident. Number 2, urine or bowel incontinence, meaning you're unable to hold it. Number 3, saddle anesthesia, which really means numbness or tingling in the genital area, hence the word saddle. Number 4, motor weakness of the legs, like all of a sudden you're weak on one side or both. Number 5, neurologic symptoms such as tingling or numbness of the legs. Number 6, unexplainable fevers. Number 7, unintentional weight loss. Number 8, history of cancer. As long as you don't have any of these red flags, here are 6 tips to treat acute low back pain on your own without a visit to the doctor. Here we go. Number 1, apply ice and heat. You can even rotate the two, like do 20 minutes ice, take it off, and then put 20 minutes heat. Do this 3 or 4 times a day, but in general, do whatever feels good. If ice only feels good and heat doesn't help, then stick to ice. Number 2, stretching. Do not allow your back muscles to stiffen. Stretch them several times a day. This is a mistake that a lot of patients make. And number 3, anti-inflammatories, like over-the-counter ibuprofen, 600 or even 800 milligrams 3 times a day around the clock for a short time period, like let's say 7 days. Because it's not just for pain relief, but it actually calms down the inflammation. So now be careful, because not everyone can take anti-inflammatories, like people who have chronic kidney disease, or those who have a bleeding ulcer, or if you're on a blood thinner. So make sure to check with your doctor first. Number 4, an over-the-counter back brace that you can find at the local pharmacy can help give you that extra support for a short time period, but be careful because long-term use can actually weaken the muscles. Number 5, activity modification. This one's important. Avoid strenuous activity for a time period. For instance, if you paddleboard or if you bench press at the gym, you may want to stop doing that for a time period, let everything calm down, and then once the pain resolves, then gradually go back to those activities again, but gradually. At the same time though, you don't want to be on bed rest either, because bed rest has been shown to actually worsen low back pain. So use common sense. Go about your daily activity, but don't do anything strenuous. And lastly, number 6, the tincture of time. Time is a healer. But if the above 6 tips are ineffective after a month, a visit to your doctor is warranted. They can prescribe other treatments such as corticosteroids, muscle relaxants, or even physical therapy. Now, if you found the information here useful, let me know by giving it a thumbs up and share it with someone else who may find it useful. Low back pain is common. And don't forget to hit that red subscribe button down here and click on that notification bell that's right next to it in order to learn more useful, actionable health tips for the busy person who can't always make it to the doctor's office. I'll also place a link to my website and social media links in the description for this video down below. All content here is strictly for informational purposes only. It's not specific medical advice, so you should always seek a licensed physician in your area regarding all health-related concerns. Well, thanks for tuning in. Stay low back healthy, and I'll catch you next time.